We got 2 doctors and 3 nurses, right? So I think we're good.
Let's go.
Well, good afternoon, everyone. My name is Dr. Antoine Sutton. I'm the district's Chester County School District Superintendent, and I would definitely like to welcome you all and thank you all for being willing to be a part of our Chester County School District Medical Task Force. As some of you may know, we didn't have a formalized task force this past school year. We kind of just made some kind of went with DHEC, was giving information that came out and worked with our school nurses, and we have our lead nurse on, Nurse Thomas, who introduced herself shortly, but we didn't have a formalized task force at the time because we already had the directives from the state level of mask mandate district-wide, and we went through that. But now that we're in, kind of in flux kind of right now, I'll use it lightly, that we're, of course, Chester County does have a mask mandate in place that the board approved in August. And as we know, there's still some back and forth with the proviso that the General Assembly put in place in late spring, early summer, that districts could not have a mask mandate in place for the risk of losing their state funding. And again, that's being challenged with the state Supreme Court right now. And we're in constant communication with our legal counsel on where we are. And again, we're not utilizing state funds or federal funds right now. So we're, in a sense, we're in compliance with the proviso. We're not utilizing state or federal funds to purchase PPE for our schools. We had a stockpile, and we are able to use local funds to purchase masks and things that we need in schools. So that's how we're staying in compliance with the proviso at this time. And so again, I thank you all for being a part of this, and we'll keep it with time and try to make sure we're mindful of everybody's time. I know definitely our medical doctors and everyone else, we work and we have things to do, and I don't believe in meeting just to be meeting. So I want this to be something that we all are engaged with and able to offer advice and give us feedback on this. So I'm looking at my agenda on the phone, so I want to keep minimizing my screen on my computer here. We'll start with introductions, and I'll start with the district office staff, and we'll leave the medical doctors for at the end in case Dr. Stone is able to join us. So I'll start with our chief officers, and I'll just call your name, and then you can go ahead and just do a little introduction, your position, what you do, and we'll go from there. So my screen might be different from yours, but right now in the top left, I have Adam Davis up there.
Good afternoon. I'm Adam Davis. I'm the Chief Operations Officer. Kind of what's in my realm is technology, transportation, facilities, and IT.
And under Mr. Davis's department, our custodial contract is under him. And so when we have quarantines or a mass number, or a large number, or outbreaks in a class or whatnot, Mr. Davis is in the loop on that because he notifies the bud group who we contract with to do some additional cleaning of the classroom, those kinds of things on that. All right, Mr. Christoph.
Good afternoon, everybody. My name is Chris Christoph. I'm the Director of Marketing and Communications here at the school district. I talk to the press, so you don't have to. But aside from talking to the media, I send out all of the notifications to the public, keeping them informed. I also handle the district website and our social media as well.
And the main part of that website, it has our district dashboard, our COVID dashboard that he updates for the district. So that's definitely for this meeting. We don't want to leave that part out.
Correct.
He maintains the dashboard for us. All right, thank you. All right, Dr. Pickens.
Yes, I'm Will Pickens, the Chief Administrative Services Officer, and the bulk of my role is anything student services, as well as community and business partnerships, and then I support adult education and our alternative program, and also serves as the district ombudsman. So all of the parent and concerns and complaints come to my office. So glad to be here.
All right, thank you. All right, Mr. Sumter.
All right, Wendell Sumter, Chief Human Resources Officer for the Chester County School District. You pretty much know what I do: hire and hopefully don't have to fire people. But basically the support. But the support, of course, finding qualified faculty and staff for our schools and for our students in our community.
Thank you. Ms. Khalid.
Screen just froze, so hopefully But I'm Denise Khalid. This is my first year in Chester County School District. I'm the Chief Academic Officer, so all things curriculum, instruction, and assessment fall under my department, as well as special services, which is for our students with IEPs, and then nurses also are within that executive directors supervision, and so that falls under academics as well.
Thank you. All right, Ms. Jeanette.
Good afternoon. I'm Melanie Jeanette. I'm the District Chief Financial Officer, and so we do all things financial. Make sure our employees get paid, pay our bills, and student nutrition services also falls under our division.
All right, thank you. All right, Ms. Thomas.
Might help if I unmute.
Yeah.
I'm Christy Thomas. I am one of the co-lead nurses for our district. I am the COVID lead nurse for our district. I am the school nurse at Louisville High School as well, and have an awesome team of nurses that work beside me. So.
All right, thank you. Ms. Barnett.
Hi, I'm Jerry Barnett, and I'm the school nurse at Great Falls Elementary. I've been there 14 years, and I'm also working on my master's at USC Upstate for education, and I'm very happy to be with this team, and I also work with a great group of nurses and love all these children.
Thank you. All right, Ms. Jenkins.
Good afternoon. I'm Nurse Ginger Jenkins. I am the school nurse for Chester Park School of Inquiry. This is my 4th school year, and I was a pediatric nurse for 10 years in the hospital before coming to the school. So I'm excited to be here, and thank you for the opportunity.
All right, thank you. And I will just have to put a plug in on our nurses for everyone, just to have it on record. Our nurses are amazing in what they have done for the district last school year and this current school year. They have their normal or their regular responsibilities as far as taking temperatures here and there and giving medications and these different things they're doing. But they're, in addition to that, they're keeping up with our contact tracing when there's a positive case or potential case. They're tracking down, looking at video footage, trying to find out who was near who in 15 minutes or less or this or that to make sure students are quarantined that need to be. So I definitely hats off to the nurses for what they do. They're definitely going above and beyond. And I just can't say that enough. So thank you to all the 3 of you on the task force, but definitely to all the nurses in the Chester County School District for your work. All right, we have Dr. Daniel.
Good afternoon, everyone. Thanks for having me on the team. My name is Roosevelt Daniel. I'm an internist and pediatrician. I work at North Central Family Medical Center. I've been working in South Carolina about since 2005, but here in Rock Hill over the last 6 years. And yeah, hats off to the nurses doing the contact tracing. My goodness, I know Ginger. I worked with her back at Piedmont, so I know she's y'all are in good company with her for sure. But I'm just really excited to be a part of this task force so we can discuss and try to get these kids and staff taken care of during this pandemic.
Thank you. Thank you. All right, Dr. Days.
Good afternoon again, everyone. It is great to be with you, and I appreciate Dr. Sutton's leadership and appreciate the opportunity to share with you in this campaign against COVID-19 in the school system and beyond. I am a family physician. I actually have worked with North Central there in Chester in the past. I do some work with the state of South Carolina Department of Corrections currently. I'm also the health director for the 7th Episcopal District of the AME Church, which includes 510 AME churches in South Carolina. And some of the protocols that I have seen from the school system are some of the similar protocols that we are putting in place for our gatherings as well. And so looking forward to working with this group, and hats off to all that you have been doing thus far. It is incredible that you guys have the protocols in place that you have in place, and that you have the dashboard that you have in place. I don't see that everywhere. So hats off to you.
Thank you. All right, we have Dr. Stone who just joined in. Dr. Stone, we're just doing introductions, and you came at the right time. If you just tell us who you are, how long you've been practicing, that kind of thing, and
okay.
We'll go from there.
All right. Sam Stone. I'm a family doctor here in Chester. Grew up, went to school here in Chester. Family's here. Y'all probably know most of my family in the schools. My oldest son's a mental health specialist and his wife's speech pathologist. My other son and his wife teach English. Very involved in the community, just love it here and appreciate y'all letting me be a part of this. I may be kind of running back and forth, so if you see me disappear, I'm still here, okay?
Yeah.
Appreciate it.
We
Go
understand.
Tigers.
Go Tigers.
Who said that? Was that Mr. Davis?
Smart man.
Get in that game now.
All right, well,
I'm a Tiger too.
I'll have that's allowable for the purpose of this task force. I won't start on anything else on that. Next on the agenda is the purpose of the task force. And it's pretty simple for me, and Dr. Pickens can definitely feel free to add in if anything else I might omit, but it's simple. Our goal is just to be able to come together and share ideas, and definitely for the medical professionals, anything you're experiencing in your various roles that could help us as a district keep schools open, keep students and our staff members safe. It's that simple. What we want to talk about, what we're currently doing, and if we need to do anything else or take something away, that kind of thing, please share that with us. But again, it's simple. How do we keep students and staff safe, and how do we keep and working to keep our schools open? That's it. That's all we're trying to do here, trying to accomplish. So any preventative measures, anything to help mitigate COVID or anything, please, that's what we want. We're wanting feedback from. And again, we have our nurses here who are on the front lines in our schools. They'll start sharing out some things that they currently do. And the doctors, if y'all could just chime in on that as we go through as well. And then the other staff members, anything you've experienced or feel free to do as well. All right, that's anything else on purpose, Dr. Pickens? Do you think that was good? Or
No, that was great, Dr. Sutton. I would just say this, honestly, we just want to lean on our medical experts, our tried and true professionals who can give us this information to help inform our decisions. And so, yes, we're amongst those who know it, who are experiencing it, and who can give us some guidance.
Okay. And just for the record, our intent is to, of course, we're recording this because our goal is to have it upload to our YouTube page where the public can go back and just listen and that as well, so they can hear what medical professionals are saying of things that we're doing. If we're right, if we're wrong on something, they're in the know as well. Because I'm very big on transparency. And again, we have nothing that we're trying to hide. There's nothing to hide. We're a public body, and we're here to serve the students in the community of Chester County. So our meetings will be posted to YouTube for the public to view at a later date. Next on the agenda is the mask mandate status. As I mentioned earlier, the district the board voted 6-1 at the end of August to implement policy ADD, which is facial coverings policy. And it just states that anyone that comes on any of the Chester County School District campuses, that they have to have a facial covering on, a mask of some sort. And it's that simple. And of course, with that right now, we've had pushback. Of course, that's something that's, as you know, it's gone from beyond being something that's based for science and in healthcare. Is a lot of it's political, and we know we have that's spilled over into our county in certain parts of the county. So and throughout, not the certain parts, but just in the county as a whole. So, and it's happening everywhere. I think there are about 11 or so districts that have also went ahead and passed a mask mandate. The boards have. And in our area, we have, of course, Chester County, we were first, and then York School District 1, they actually passed one a few weeks ago as well in our region. So, and there's several others in the state that have gone on. Marlborough County has one. And so I'm not going to start naming because then I'll leave districts out. But there are other districts. Florence as well has one in place. And so, but we're one of several that have had this. And of course, the state proviso that the General Assembly approved and put into the budget back in the late spring states that districts could not pass a mask mandate on their own, and the possibility that they could withhold our state funding. And Mr. Jeanette can correct me if I'm wrong, but I think that's close to 47% of our state, our budget comes from the state funding. Is that correct, Ms. Jeanette? It's in the 40-something% range?
Yes, sir.
State funding. So as you know, that would be devastating for the state to come in and take, let's say 40% of our entire, our district budget for the year. That would be a huge negative impact. So right now, we're in constant contact with our legal counsel before we even presented the policy to the board in August to hear, for them to give us feedback on if they wanted to reinstate or not. And again, based on the information we received from legal counsel, we felt strongly that we would still be able to work within being in compliance with the proviso. We're not utilizing state or federal money to implement this. We had a stockpile of masks, and we're able to use our local funds, our activity money at the school level is what it's called, people fund, that they could make purchases of masks. But we're also reaching out to our faith-based partners that have a partnership with every school in our district, and they're helping us, and Dr. Pickens spearheads that. They will also help us and donate masks. So our schools will not, most likely will not have to use any of their funds from the school level to buy masks, because we have them for students that need them as well. So that's where we are right now. We're still waiting on the outcome of the state Supreme Court case with Richland School District 2, and Charleston County joined that with them as well to repeal the proviso 1.108. And if it's repealed and the state, if they do that, then districts would have the option to pass mandates at the local level. And again, it's important that the public know that the goal is not to have the mandate in place just to have it, but we'll have it in place as needed. And right now it's in place for, I informed the board that we'll do every 60 days. It went into effect August 30th, and our 60-day time period will be up at our October 25th board meeting, is where we will share the data with the board. And we want to hear from the doctors on this. Anything we need to share, because we'll meet once more before the October meeting. Anything we need to share and your recommendations on that. If you all think that we're fine without having a mask mandate or something, then we'll share that with the board. But we want to have that information to make informed decisions based on science and what's best for Chester County. So at the October meeting, we'll share the facts, the data with the board, and then at that time they will either vote to keep the policy in place another 60 days, or they could rescind it and suspend it for 60 days or a time period based on community spread and where our cases are in the county and our school district. So that's where we're on the status of the mask mandate. But again, for the record, we're not right now, based on information from our legal counsel, we're not violating state law. We're not doing anything illegal, because again, that's not our goal to do anything that's illegal. All we're trying to do is keep people safe and not have deaths on our hands for not having the mask mandate in place, because that's happening all around us in our schools, in other districts. We've had a lot of our students have had parents that have other loved ones that have passed away due to COVID. So that's an update on as far as the mask mandate, our policy itself. Now we move on to sharing of district protocols, and Nurse Thomas can start off with that, just bringing everyone to speed on how our protocols work as far as what we're currently doing in schools, and when there's a positive case or anything like that, what happens then as far as quarantine and that kind of thing.
Right now, what we're doing is once a case is, once they are made known as positive to us, we do follow DHEC guidelines as well as CDC guidelines or recommendations, but the DHEC guidelines are the ones that we have adopted for the district, and the newest updated information did come out the first week of September. So, and what that tells us to do is now when someone is positive, they have a mandatory quarantine time of 10 days. Anyone who is considered to be close contact to that person in our school setting, that would mean anyone who is within 3 feet with or without a mask, or anyone who 3 to 6 feet, as long as both wear a mask, they would not have to quarantine. But if one or the other did not mask, then they would have to quarantine. During that 14-day quarantine for the close contact, we have adopted the guideline of shortened quarantine time of, on the 7th day, if you are asymptomatic and test negative, you may return on day 8. If you choose not to test, on day 10, if you are asymptomatic, you may return on day 11. However, with both of these shortened quarantine times, you are required to wear a mask the remainder of the 14-day quarantine period. And also monitor yourself for symptoms continuously throughout that extended quarantine. The only other difference would be is if the person is considered to be a household contact, that would be a 24-day quarantine because of the 10-day isolation period of the person they are exposed to, unless they can isolate away from that person. And if they can, they just go into the 14-day quarantine. Otherwise, it's the 24-day with the shortened quarantine period. I know that sounded like a mouthful of numbers and days, and it is, but That's our guidelines as of right now.
Thank you. Nurse Barnett or Ms. Jenkins, anything you would like to add to that?
I think she pretty much covered the guidelines that we are all trying to follow. And I must say, pretty much the feedback from the parents, if I have to put them on quarantine or the children, or, you know, give them these certain scenarios and what they have to do with the children, they have all been pretty appreciative and cooperative to do what the right thing is to do to keep their child safe and to keep all of us, you know, safe and the children safe at school. So I think pretty much those are the guidelines we are following and going strictly by.
Nurse Thomas, what is the largest number that you've had to quarantine at one time? You could share that.
The largest that I have quarantined at one time for one specific positive case is 56, but that included our football team. In the school as a whole, the largest group I have had to quarantine myself, I think was 38. And that was from multiple classrooms that included PE classes. And I will kind of piggyback in on one thing Jerry said. There are some certain scenarios that you kind of have to investigate. And in those times, there may be certain considerations that are made, but we do have an epidemiology team in Columbia that we can call and run those scenarios by and receive guidance from them and make sure that we're staying in compliance with DHEC as well as our district policies.
Thank you. Mr. Davis, anything you want to add about protocols as far as the cleaning side would like to share? What we do now when we're notified of cases in classrooms or anything?
Yeah, so when we're notified of a positive case, we'll go in there and disinfect and do a thorough cleaning there. As speaking to my counterparts across the state, as far as day-to-day, they're disinfecting maybe 50% of their buildings or a quarter of their buildings a day. And most of our facilities, we're doing the whole campus daily, except a few campuses that are just large. So we're hitting them as often, as frequently as possible. And I think that's why our numbers are as low as they are right now.
All right, thank you. And another one I failed to mention earlier is that as you may have seen on the news, the state sent out a memo maybe a few weeks ago that masks are mandated on school buses. So they sent that out that they have to wear them on buses, but then they don't have to wear them in the school building. So as you all know, that puts us in a very difficult place to tell kids, okay, you can get on the bus and ride to school with it on, but when you get to the school building, you can take it off. That's kind of where things are if we don't have a mask mandate. And again, with the mask mandate, still we're not keeping kids out of school. So if they come to school without a mask and they don't take one from a school official, then we don't send them home, so they still remain in school. So we do have students in our schools right now, even some staff members that aren't wearing masks on a daily basis right now. And so anything else from senior staff you want to mention on protocols? We are feeding students. Well, no, we're not. Just the virtual students are being fed, but if they're quarantined, they're eating at home, right, Ms. Jeanette?
Yes, sir.
All right. Okay. Let me see what else I have. All right. Now, discussion on our cases. So what I like to hear from the medical doctors on is what y'all experience and what you're hearing in your groups on Chester County as a whole. Where are we as far as where our numbers are? What's the kind of look like? Are we on a decline or is it increasing or that kind of things? Well, we kind of want to hear from you all.
If you look at the numbers right now, they are I think part of it's because school started, it's peaking, maybe coming down, but we're still losing people dying, and it's the younger age groups, the 50-year-olds, which would be the parents, grandparents. I think that we peaked about 200 cases about 2 weeks ago, 150 last week. And so far this week, I think it's been like 60 cases. But those are ones that we're documenting. We don't know the ones that aren't being tested or, there are plenty of people that have it that don't want to be tested because if they test and positive, they have to admit they have it. We are one of the highest per capita in the state. I know we got close to 4,700 cases in Chester County, and if you look at what a county of 35,000 people, that's less than, that's a big chunk of people. I do think wearing the mask in school definitely is helping, and I do appreciate that. I know it's a risk, but you're doing it because it's not just the kids that are at risk; it's the teachers, the cafeteria workers. But then the kids bring it home. I hate to say the kids are little germ factories, but they are, they carry germs everywhere and they may have a runny nose. Personal case, I had COVID 3.5 weeks ago. I think I got it from a 2-year-old looking in their ear. 2-year-old didn't have a mask on, I did. But thank heavens for the vaccine, I was only sick for 24 hours. Never had any respiratory problems. The other thing I like to somehow push is when they drop the vaccine age down, is being able to set up vaccine clinics around the county so we can start pushing. I mean, I know political and all that, but if we offer it, yeah, we could start vaccinating a lot of kids because that's the only way this thing's going to go away. Wearing masks helps, but as long as it has a place to grow, it's going to keep spreading and it's going to keep mutating. And we got the Delta now and, whatever else, what other Greek letters you want. It's going to keep going around. So I do appreciate y'all's effort as far as masking, social distancing, the quarantine, because it's very, very contagious. If I can get it from a 2-year-old with a mask on, yeah, anybody can get it. So I appreciate it. Dave, you have anything you want to say about it too?
Thank you, Dr. Stone, and to the school district. And I agree with Dr. Stone that what you are doing in Chester County is a big plus to the students, to the personnel, but also to the county, because in essence, you are decreasing the risk that the infection spreads in the school system, and thereby using Dr. Stone's example of a child taking it home, you're decreasing the risk of it being shared in the community as well. One of the things that we know about the statistics that Dr. Stone mentioned is that the numbers went up until maybe a couple of weeks ago, but then they began to come down. The reason they went up is because of this Delta variant. Dr. Stone mentioned that it is more contagious than the other variants that have been exposed 2 to 4. However, because of that contagion, the initial Alpha variant maybe was spread to 2 or 3 people by one person who was infected. The Delta up to 8 or 9 persons by one person who is infected, and so it increases the risk. And so the fact that you have implemented a mask mandate says that you are concerned about the safety of your children, but you're also thinking about the broader community as well, because it diminishes that spread. One of the things that the CDC has recommended now is that vaccinated persons in the indoor setting, particularly in the school system, use masks, and so we know that is accurate, simply because of the nature of this virus, that we're still understanding some of the attributes of this virus that has caused this pandemic. One last thing, the sheer number of persons who have been infected by this virus increases the risk of mutants forming. A mutated virus is forming, and so if we can diminish the spread of the virus, we not only help to protect the community at the present time, but we help to protect the community in the future as well, because we diminish the risk of additional mutations and other mutant viruses having more characteristics that are more dangerous to society and that are more apt to spread the virus and the pandemic even further than it has spread. So wearing the mask, I think, is extremely important in terms of keeping our youth from getting sick, but also in terms of spreading the virus even further. having that 3-foot distance that was mentioned earlier between youth is very important. I think there are some studies that have shown that 3-foot distance is important between youth, particularly youth below age 13. It may not be as helpful between youth and adults, and so even 6-foot distance or screens can be beneficial in that case. And so, I think the school system has so many protections in place, given everything that I've heard and what I've seen on the website, that it decreases the risk of spread. And so you have multiple layers of protections, and I think that is very important, not only to our youth and to our school system, but to the broader community as well.
Thank you, Dr. Davis. Dr. Daniel?
Yeah, Dr. Daniel. So I'd agree with my colleagues here on all their points, and it's simple but not easy. So we have a virus that has entered our space, our population, and it's a race between us trying to stay ahead of getting sick from it and it changing to find new ways to make us sick or faster ways to make us sick. So the Delta variant, I can assure you, will not be the last variant. So hardwiring these processes like you folks have done, you've kind of stayed ahead of the curve, especially when you're looking at a population that really now can't be vaccinated. I mean, anyone 12 and under can't be vaccinated, based on where we have our current FDA approval. So the only way for us to get ahead of this virus is to increase our immunity and be steadfast on protecting each other from it. And masks are about the easiest way for us to do that. And the reason I bring up the mask, and I appreciate it's so important, there are a vast majority of people, probably up to a third, that will never take any vaccine, no matter what vaccine it is. So it's not even COVID, it could be a bald vaccine, not that I would be afraid of that. But any vaccine, you just have people that won't take it. So you have to tell them, yes, I understand that you appreciate your natural immunity, but one of the things you can do is provide a barrier for yourself and the people that you care about. And that message, I think, really has to be pushed forward. For people who come up with all the reasons why people shouldn't wear masks, I don't think the lives of the elderly or the lives of their children should be on that list. And trying to, communicate that to people in a compassionate way is going to be helpful. And while we wait on that, the mask mandate is very helpful. If you look at the cases now, almost 20% of the cases that are in Chester County are of people who are 20 and younger. So that's all the students that you have there, again, that we can't vaccinate. If you look at what the Delta variant did in other countries, it came in, it burned through the population like crazy, and then the cases started to decrease. Fortunately, even though this Delta variant spreads much more quickly, fortunately it's not as lethal. That does not mean it's lethal, but it's not as lethal. But the next variant's right around the corner. So this is a marathon, not a sprint. We're going to have to keep these masks. And again, I think the school system has done an excellent job with that. I don't know where the county is on vaccine mandates for staff or whether they're going to be regular testing, but that's something that this task force needs to be prepared to bring to the board if that question comes up, because President Biden has kind of pushed that issue forward. And I don't know what conversations you've had, but I think it's a good one to have either here or by email to kind of get a plan around that if that occurs. So, but I agree with my other colleagues. They already took the good stuff, so I just got what was left.
We'll let you go first next time before the other two.
Exactly. Thank you.
All right. When it comes down to, I guess, from the doctors, what do you think as a district we need to look at when we're determining, as far as the board to consider when they look at in October to extend the mandate out or to suspend it? What is a key thing we need to share with the board? Is there anything other than what our case counts are? How many positive or quarantine? Is there anything else we should make sure we share with the board and the public to help them making that decision?
One of the things that the CDC World Health Organization agree on, one of the few things, is the test positivity rates. So if you look at the CDC and the World Health Organization, when you look at what your positivity rate is, you want it less than 5%. 5% is considered low. I think anything beyond that, you need to put measures in place. Right now, we have been, in the state of South Carolina, we've been hovering somewhere between about 7 and 17%, depending upon who you ask, probably since March, because we saw a huge spike in the winter. And I think we got below 5%, you know, at some time between like April and May. But right now, when it's at 17%, the CDC has definitions. I got a short PowerPoint that I put together that I could send to you guys with what their definitions are. But when that positivity rate is at greater than 10%, you're considered high. And it's all hands on deck, which is where we are now, and probably will be at least through January. So I would look at that positivity rate. I think that's one of the public health markers that they have. And the vaccination rate for the state. Right now, the state fully vaccinated, Chester County, 37%. South Carolina's at about 47%. As long as those vaccination rates stay below 70, your risk of contracting the virus is still very high. So unless both of those things happen, I think we need to be all hands on deck trying to keep this mask mandate in place.
And you said Chester County is currently at about 30%?
37.49% is, as of yesterday, fully vaccinated. At least one dose, about 43%. When you compare to the rest of the United States, 56% are fully vaccinated. Active duty military, only 62% fully vaccinated. So when you talk about herd immunity from a public health standpoint, 70% or better is what you want. Now, what you don't have in there are the people who have natural immunity, but we don't have a lot of science to use that as a hard number right now. So we have to use a vaccination status. So unless those two things happen, less than 5% positivity and greater than 70% vaccination rate in your area, still high risk. You need to be pushing with mask mandates. That's my opinion.
All right. Dr. Days, anything?
Thank you. That is a very important question in terms of as Dr. Daniel mentioned, the vaccination rate and the COVID rate. The other thing that I look at is the death rate, and that has been particularly important in gauging death rate with certain age groups compared to certain age groups and races compared to death rate during other spikes. For example, this recent spike compared to the January spike, and so that helps to inform. In regards to the idea of continuing to wear the mask, I think it's very important until we get to a goodly number of vaccinated persons to encourage mask wearing. One of the things, and I mentioned earlier that I am a health director for the 7th Episcopal District of the AME Church. I'm also on the International Health Commission for the AME Church as an executive board member. And one of the things that some of our other executive teams have been privileged to do is they are advisors with CDC. They were advisors before they came to our board with CDC and the FDA in terms of these viruses, but also in terms of the vaccinations. And so the repetitive thing that I have picked up off of these meetings is that we are not there yet in terms of the vaccination status. Dr. Daniel mentioned 70%. The number has ranged somewhere between 70 to 90%. I asked some of these folk who work with the CDC what the real number is because of that range between 70 and 90%, and they say that the best would be to get to that 90%. 70% is the least, but the probably the most accurate number is 80% vaccinated. That is going to be a hard thing to push here in this nation at this point. But we're not there yet, and so mask and the other layered approaches that I mentioned earlier are going to be very important. I have overseen planning for 6 conferences, which are 90 plus or minus churches, and 1 conference that's coming up in November that is all 510 of our churches, representatives from all of those churches. One of the things that we have done is we have not allowed anyone in, and I know that this can't happen in the school system, but it's just to say how significant this vaccination issue is. We have not allowed anyone in into these conferences who have not been fully vaccinated, and 2 weeks, at least 2 weeks prior to the conference, we have tested every day. That may seem like overkill because you're not necessarily going to test positive until 3 days after, but folks may have been exposed prior to knowing it. So we're testing every day, and we're also doing vaccination clinics, not for the people who are coming to the conference, but as a gift to the community at these conferences. And so I say that to say, at the second conference, a person who attended the conference ended up testing positive. And that positive followed 2 days of testing negative. And he was in the conference. And so it behooves us to be prepared. The best thing that we can do for ourselves is to be fully vaccinated, because that, even though the Delta may have some breakthrough cases amongst the fully vaccinated, the death rate is significantly lower. I believe it's something like 1 in 100,000 amongst folk who are fully vaccinated, that the risk compared to those who are not fully vaccinated. And so being fully vaccinated decreases your risk of death. Being fully vaccinated decreases your risk significantly of hospitalization. And so we're not only protecting each other by being fully vaccinated, but we're protecting ourselves and our family members by being fully vaccinated.
All right. Thank you, Dr. Stone. Anything?
Yeah, all the numbers, what we're talking about with the positivity rate, we need to look at what's going on in the community and the schools. But the other thing that I'm concerned about, in another 3 or 4 weeks, the temperature is going to start getting colder, the weather's going to get worse, and kids are not going to be going outside as much to play. So you're going to have a captive audience longer in a closed building, which will breed outbreak. So I think it's important that we don't, when the numbers do dip, stop the mask, because like I say, when the weather gets bad, germs are inside, not outside. And you put all those kids in a warm building, closed in, it's going to spike up again, and not even counting if we don't have another variant yet. So my philosophy is, if it's working, change it. Let's keep the mask going, and let's just try to get to Christmas and take a break, and then reassess. So I'm already thinking way ahead Christmas. So
Yes. Dr. Days, you had something to add? You're muted.
I keep muting, Dr. I'm not.
Dr. Stone said something that's very important, because the pandemic began to spike again in July, August, because of the Delta variant, obviously, and the increased contagion. But it came down because people saw the effects of this Delta variant. People got concerned, and people began to implement some of the safety measures for preventing spread of COVID. And so the numbers have come down. And so implementing a plan is the most important thing that someone can do. Implementing a plan that includes not just 1 or 2 items, but I've mentioned several times, implementing a plan that includes several ways of protecting oneself, protecting one's family, and protecting one's community. And so I think having the mask mandate in place is important. Having the numbers available for folks to see is important. Having the cleaning protocols and and the disinfecting protocols in place is important. I think having a multifaceted approach to combat. This is a war. If it is truly a war, then we are acting like soldiers. Somebody said earlier, I believe it was Dr. Sutton, all hands on deck. And so all that we can do to prevent the spread of this infection, I think, becomes important for us to do. And it is not just for preserving ourselves. Obviously, that is keenly important, but it impacts the lives of others. And I'm going to grow personal here. In the pulpit Sunday, I'm also a pastor. In the pulpit Sunday, just a few minutes prior to getting up to preach, I got a text on my phone. It looked like something I needed to answer right away. So I walked out of the pulpit to answer this call. And it was a request for prayer for a 16-year-old girl and an 11-year-old boy whose father died just 3 days prior, whose mother died the night before. Their parents, each 50 years old, having died from COVID. And that breaks my heart. It is not just that we are protecting ourselves by being vaccinated. It is that, somebody mentioned earlier that those who are under 12 can't get vaccinated. We are protecting them by being fully vaccinated, because we are decreasing the spread of this infection, and thereby those who cannot be vaccinated are being secondarily protected because of the fact that we are vaccinated, wearing masks and distancing ourselves from them.
Thank you. That's powerful. That's powerful. Dr. Pickens?
Yeah, I do. So the vaccines are important. So what message do we have for folks, my doctors and my nurses? What message should we be sharing with our people when they say they don't trust the vaccine? They don't trust what's in it. They don't trust that it works. Like, speak a little bit to that.
So the best thing I would recommend is that tell them, if they have a medical professional that they trust, that they should have a conversation with them first. As a general message, just trying to explain, you really kind of have to address people's particular concerns. Some people talk about how quickly the vaccines were developed. Well, these vaccines have been worked on since 2002. That's when the research started. It just so happened that the entire planet was ready to provide resources to finish it, and we finished it. So these are not new. mRNA vaccines have been used in treatments for different types of cancer. So these aren't new vaccines. That's how I say that. That's myth number one. Number two, is the government trying to assassinate you or track you? No. I mean, why? That's a whole nother level of things. For people asking me or talking to me about myths, they think that this vaccine can track them. I have told them, if you have a debit card and a cell phone, you don't need the vaccine to track you. We already know where you are. Thirdly, just trying to explain to them, if they don't know what's in the vaccine, how many things do they put into their bodies every day they don't know the ingredients of? You can drive to any fast food restaurant in Rock Hill or York County. Nobody knows what those ingredients are. And so we are really trying to prevent people from dying and slowing a pandemic that we haven't seen for over 100 years. The last one we saw probably affected 1 out of 8 people on the planet. And we don't need that for this one, because this one was more lethal than the Spanish flu, in my opinion. So those are the things. But starting off with a trusted medical professional, because that's what a lot of people, they get into these echo chambers on social media, and there's not a single medical professional in that space that they're listening to. So they really need to find someone they trust to talk to.
Any other questions from any other task force member? One thing I'll say, Dr. Stone mentioned that I didn't even think about, and again, because I guess this the world we live in and how we do things. When it gets cold, that is true. The kids are in the classes much longer. That didn't even cross my mind at all until he brought that up. Because again, it's something we're in the school all the time. It happens. I didn't think of it as an area of concern, but that will happen because they will not be taking the kids outside as frequent. Dr. Daniel?
Yeah, one of the things we do positively absolutely know about this virus is that it does spread amongst people indoors very well, much better than outside. And some people have even theorized that the spike in around spring break and in the summertime in places like Florida and Arizona is really because people are moving more inside. So those air conditioning ducts with air that you dry out allows it to spread a lot more easily. How does that happen? The virus knows how to attach to dust and other particles. Dust particles are going through, coronavirus hatches a ride. That's one of the reasons why the masks work, because obviously a virus could be small enough to get through a mask, but not if it's riding on a dust particle that gets caught by the mask. So that's another key feature to kind of have a conversation, just myth busting with people when they say the masks don't work. I also think that the school needs to look at routine testing of athletes that are participating in sports, obviously, especially as we go into doors. That also includes band concerts and chorus concerts as we start to head into the winter season when people start having Christmas cantatas.
Okay. And chorus. I'm typing this all out on my phone.
I will touch on the testing aspect for a second. We do have rapid tests available in our schools for some students that are symptomatic at this time. We have not taken that step to do prophylactic, so to speak, testing and random testing of athletes and band members. The tests that we have right now are more for those who are symptomatic or who are trying to return to school early from quarantine, staff members who are symptomatic or who may have been exposed. They call in or either come to us here at school. A consent form does have to be signed, of course, by a parent, legal guardian, or the staff member. But we have been doing some rapid testing in the schools. We just have not moved to the athletic groups yet, as some guidelines do suggest.
And with that, I will say the rapid test, unless the person has a significant amount of mucus in their nose from being sick, it'll miss it half the time. And Ms. Thomas, you're exactly right. That's why we don't use the rapid test to screen people who are, or to screen. I mean, these are people who are asymptomatic. A big portion of Europe has decided not to even test people who are not symptomatic, but their vaccination rates are much higher than ours. So if it's going to be asymptomatic testing, it has to be a PCR test. A rapid test will not be reliable. You will miss it half of the time.
Good to know. All right. Any other questions for our medical partners? This was some great information for our first meeting. Now we've gotten, of course, we have some notes and we'll look back at this and type out some notes as well. The next thing is our next steps and any closing remarks from any medical professional, if you have any closing remarks. But next steps, again, we'll work on another meeting for the first early part of October, maybe mid-October, for our next board meeting. And that's where we'll discuss, look at our numbers at that point, where we are as a district at that point, look at numbers, where we are as far as positive students in quarantines, and we'll look again at the county positivity rate and the death rate, the things that you all mentioned. We'll pull that information and we'll discuss it on this forum, and then we'll discuss how we'll go about. We'll share this with the board, of course, and at that point is up at the board's discretion what they do. All as superintendent, all I can do is recommend, and then the board has to be the ones to vote on what to do moving forward. And so, any other questions on next steps? So when Dr. Pickens will coordinate with the date that works for the medical professionals and everyone. Dr. Daniel?
Yeah, I'm sorry. I'm trying to make up for, not being first last time. So
yes, sir.
I do have the floor. Just a couple of things from our experience here at North Central. We have well over 100 employees. Two of the things I would strongly consider that you have a plan for before the board comes to ask this question. Number one, what is going to be the position on mandatory vaccines and routine testing of staff? The second one is when staff have to take leave because of quarantine and they run out of sick days and paid time off, some type of plan, whether it's a borrow back or a timeshare, or is the district going to give time? Not that we'd want any of that to happen, but it was our experience to have better had that conversation before it happens than to have it happen and have it the other way around. So just to give some thought with your HR folks, there's a lot of resources around COVID and time off, making sure that your HR department looks at that. because that also can help you retain some very good teachers if you have a really good organized response. If they hear about Mrs. Johnson in one part of Chester, you know, God forbid he or she runs out of time off and she has to lose pay because of a COVID policy. So these are things you really have to consider and be ready when the board comes to you with that.
Okay, thank you. And Mr. Sumter, have we had any staff members so far to run out of time due to COVID?
We haven't had any to run out of time. I did receive a request from an employee who needed time for it later in the year and was wondering if there was going to be something that would be adjusted so that she wouldn't lose personal days that she had to take later on. So that's the only thing I've run into, you know, because we're doing the 5 days, we're giving them 5 days off the top. And we discussed previously, and we haven't made this public with anyone, but we did discuss giving an additional 5 days in the spring, so that, you know, if people do have, you know, somebody comes back around and they have it again, then we can offer that in the spring to them as well. You know, I would say that our current policy has helped to cut down on the number of people. I feel like last year we offered it whenever somebody said that they had an issue or were close contact or, you know, things, and we had a lot of people who used it. I wouldn't necessarily say they abused it, but we were one of the only districts that did allow them to use the leave whenever they needed the COVID leave. And talking with some districts now, some of them are not offering any leave at all for COVID. People have to use their personal leave, you know, or their sick leave. But fortunately, we are in a place where at this point, we at least are looking at the 5. And then if we have to add additional 5 in the spring, I don't see where that would necessarily be a problem. But I've only received one request, and that was a person who had enough time to really cover the extra days that she had to be quarantined, but didn't want to use it because she said she had some other things planned in another month.
All right, thank you. And that's, Dr. Daniel, we definitely will continue to have those discussions on that as well, because that is important too. So that's something we will share with the board as well. All right. Again, Dr. Pickens will coordinate with everyone as far as a date in October. Any closing remarks from our 3 nurses or our medical doctors?
I just want to say again how impressive what you all have done so far has been, and I look forward to seeing new plans implemented as we survey what's going on in Chester County and new developments that are developing with the pandemic.
Thank you. Anyone else before we? All right. Well, I definitely will. Again, it means a lot that you all took the time out of your busy schedules. Definitely the medical doctors to come and, you know, share your thoughts and your expertise with us, and definitely our school nurses, because I know they've had long days and some have had long nights. So definitely thank you all. If I could give you all days off, I would. But I'll give you Saturday and Sunday coming up. You can take those 2 days before you come back on Monday. So thank you, Superintendent. Thank you. Yes. So. But definitely appreciate everyone. Again, I think that we have a good group of people that can really give us input and make sure we make the best decisions to keep our students and staff safe in Chester County and beyond, because, you know, a lot of us people live outside Chester County. So, and students have parents that work in other districts, so there's a whole lot of things that intertwine and domino effect of if somebody's positive, it doesn't just stay in Chester County. It goes out throughout our region or, you know, throughout the state. You just never know. So definitely thank you all for your time. We'll coordinate a date and we'll get back on this. And I look forward to working with you all to make the best informed decisions for Chester County School District. Again, thank you and have a,
and Dr. Pickens, before we leave, if there is a time next month that does not work, a day or days that do not work for you, please email that to me so that I can stay away from that time, because I would like to have more rich conversations than everybody at the table. Thank you.
All right. Thank you, and you have a great afternoon.
Thanks. Bye-bye.
Bye.
Thank you.
Bye, everyone.